Welcome to Part 3 lesson related to interventions for clients with urinary problems. Okay, urolithiasis. This are stones in the urinary tract. You have nephrolithiasis and ureterolithiasis. It's about greater than 10% of people that will form stones. It's believed to be a metabolic disturbance as part of a risk factor. And then the formation of stones involves three conditions. One, slow urine flow. Uh, Two, damage to the lining of the urinary tract. And three, decreased inhibition substances and crystal aggregation. Also, there is high urine acidity or alkalinity, as well as some medications contributions. Stones may occlude the urethra and cause dilation. There could be urethral spasms that is excruciating and it can lead to shock. And then there's hydronephrosis that can occur, or filling of the kidney with urine, which can cause permanent damage to the kidney. There's a possibility for dehydration, urinary stasis, retention, and then immobilization that all contribute to stone formation. So while assessing for a stone, you want to obtain the diet, the history, the intake patterns, and the history of stone formation. You want to check on clinical manifestations. They may develop oliguria or anuria, which is total absence of urine. Urinary tract obstruction by stone is treated as an emergency. You want to do lab tests such as a urinalysis. It will have red blood cells that are present. There will be an increase in turbidity and odor, and there may also be crystals that are present in the urinalysis. The patient may experience renal colic. They're going to have pain, especially when the stone's moving. They may have nausea, vomiting, pallor, diaphoresis. They may have frequency and dysuria that occurs when the stone is in the bladder. There may be a possibility to do a KUB, have an IV, test through CT, or even an MRI. Okay, so what are some of the nursing implications? Well, we definitely want pain management. It's most often done with opioid and NSAIDs. You want to prevent infections. Most patients will actually expel the stones without surgery. It does depend on composition, size, and location. The larger and the higher, the less likely they're going to be able to pass, and then they're going to have surgery. So you definitely want to strain all urine to look for the stone. Okay, let's discuss lithotripsy. This is the use of a sound laser or dry shockwave energies that break up the stone into smaller fragments. Conscious sedation is used on the patient. You may also apply a local anesthetic cream. It's actually applied to the skin site for about 45 minutes prior to the procedure. There is an ECG monitoring that's done during the procedure, and the shock is actually delivered during the R wave. Bruising may occur on the flank of the affected side, and it can be quite extensive and take weeks to clear up. So one of the things you need to do as a nurse is to apply ice to the area immediately after the lithotripsy is completed. Okay, for surgery, there's stenting, retrograde ureteroscopy, percutaneous urolithotomy, and nephrolithotomy. If all else fails, they will do the ureterolithotomy or the pylolithotomy or nephrolithotomy. And there could be a possibility of having drains and tubes in place afterwards. You want to monitor for the amount of bleeding from the incisions and in the urine, and then maintain a good fluid intake and make sure that you're straining the urine. So collaborative care is going to involve, okay, let's talk about antibiotics. We're going to use a broad spectrum antibiotic. Struvite Stone formation are always accompanied with infection, and these patients will be monitored long term for infection. And drugs that prevent bacteria from splitting urea, such as Hydrea, are used long term in struvite patients. So we also want to encourage prevention, and we can do this through encouraging PO fluids of 3 liters or more per day. Monitor the patient's medications that they're taking to make sure that it's not affecting the kidneys or the urinary section. And then we also might want to encourage good diet modification. Okay, let's talk about a few of the different types of stones. We have the calcium containing stones. There are drugs to treat hypercalciuria, or these are the thiazide diuretics like diuryl or hydrochlorothiazide. There's orthophosphate and sodium cellulose phosphate. These agents all work differently, and they decrease the amount of calcium available to form the stones. Now, when you talk about the uric acid stones, allopurinol helps prevent the formation of these types of stones. Then we have cysteine containing stones. Treatment is usually done with capoten to lower the urine cysteine levels. Other urinary problems include cancer and exposure. 73% of urinary cancers are transitional cell carcinomas of the bladder. It is a multifocal and recurrent. It may be treated with intravesical chemotherapy. A cystectomy may be necessary, and it is the second most frequent urinary cancer in the kidney and the renal pelvis area. Exposure can include toxins, chemicals, which causes the patient to be at a greater risk for cancer. And then the greatest risk factor for bladder cancer is tobacco use. Hematuria is a major sign that occurs with bladder cancer. And then there are bladder wash specimens and bladder biopsies that are specific tests that are used for cancer. What will need to be done is a cystoscopy with a retrograde pyelography. So the surgery for cancer is cystectomy, and there are 4 alternatives: the ileal conduit, the continent pouch, the bladder reconstruction, and the ureterosigmoidostomy. Okay, let's discuss bladder trauma. This can be penetrating or a blunt injury. It can be caused from a fractured pelvis with puncture of the bladder by bone fragments. This is the most common cause of bladder trauma. It could be a seat belt can compress the bladder hard enough to cause injury, especially if the bladder is full or distended. It requires surgical intervention unless it's just a simple contusion. And then the patient is also going to need psychosocial support. This is very critical. This concludes the lesson interventions for clients with urinary problems. If you have any questions related to this lesson content, contact the instructor.